Okay, I think that should be enough time. Hi, everyone. Welcome again. My name is Scarlett Juarez from the Institute for Healthcare Advancement, and I'm here to introduce today's webinar on developing a proclamation for Health Literacy Month. I appreciate everyone for joining in today. We have some amazing speakers to hear from, and I'll be introducing them shortly. First, let's go ahead and start with some housekeeping items. So all attendees will be muted during the webinar. We will have questions and answers towards the end. Please use the Q&A feature to ask any questions. If you have any comments, please use the chat box. If you face any technical difficulties, please email support@healthliteracysolutions.org for assistance. The webinar will be recorded and posted in the Health Literacy Solutions Center site under its webinar archives in a week or so. Now, if you are requesting continuing education credits, you will have to fill out an evaluation in order to receive your CE certificate. That will be sent in an email in a couple of days after the webinar, and it will contain the link for that brief evaluation. So with that, it is my pleasure to introduce the speakers today. Today we have Joy Dupree, who's an Associate Dean for Practice Innovation, Partnerships and Policy Professor at the University of South Carolina College of Nursing. We have Lori DeRuiter Willems, who's an Assistant Professor, Departmental Honors Coordinator at the Department of Public Health and Nutrition in Eastern Illinois University. We also have Elizabeth Squires, who's an Assistant Director of External and Pipeline Projects at the National Center for Rural and Health Professions at the University of Illinois, Chicago. We also have Teresa Wagner, who's an Assistant Professor and Clinical Executive at UNT Health Science Center and Safer Care, Texas. And last but not least, we have Karen Commander, who is the Director of Organizational Development and the Health Literacy Institute at St. Vincent Charity Medical Center, Cleveland, Ohio. So with that, I am eager to hear what they all have to say, and I'll turn it over to Joy Dupree.
Thank you so much, Scarlett. I really appreciate the opportunity to be here today and to share with those around the country who are interested in getting a grassroots effort going or continuing with what they already have started to raise awareness related to health literacy. So I had the pleasure of working with IHA on developing the mini micro-credentialing that they now are offering. And as we were doing that, the community module was one that I really felt very strongly gave you the basis for how to do what we are talking about today. And I encourage all of you to look not only at that module, but the other modules to determine how you fit into that, where you are in the grand scheme of things, what work you've already done, what work needs to be done, and how you can truly have a solid, sustainable health literacy initiative. My work began really in Alabama a little over 20 years ago. In 2001, I received a grant from Pfizer, and it was to create a health literacy toolkit for caregivers of children ages 6 months to 6 years, and it lit a fire under me. About the same time, my daughter became a regular tutor, and I realized that there was a disconnect with my patients that I had not recognized as being low literate. And so it really became my life's work. I ended up, my dissertation was focused on that. And subsequently, in around 2014, I was selected by Robert Wood Johnson to, as a health literacy expert, to go into one of their executive nurse leadership programs. Through that program, I was able to work with the governor's office in the state of Alabama to develop a health literacy initiative that is listed on the CDC website. And so, if you go to the CDC, it's one of the best Center of Disease Control and Prevention website. It's one of the best websites with lots and lots of resources, including that and IHA. And so they're different. And so one has a lot of government types of repository as the CDC does. And so Alabama is listed, and we developed, from my initiative, we developed spent a year of every quarter we met with a group of 26 top leaders in our state that were identified by the governor's office. And we were able to develop a strategic plan, which is listed on that website that any state could use. And part of that is raising awareness through beginning with Proclamation. And that's really how we got started. I began in health literacy about the time that the first book, A Prescription to End Confusion, came out. And with the Pfizer opportunity, I was invited to some of the earlier precursor conferences before HARC. And I'm sure many of you, if not all of you, know about HARC, Health Literacy Research Conference that Michael Pashorlo has been chairing and running for many years. And so because of that, one thing led to another, as you know, and then I ended up going into my doctoral work and made this my research focus for the remainder of my career, and continue to work in that area. So one of the things I realized early on is that nurses, and there are many professions represented here, but you really need influential people that will help you to get this to the highest levels, to be heard and to be seen. Now, in most states, next slide. In most states, anyone can go online and you just go to your .gov website. And in South Carolina, it's sc.gov. In Alabama, it's alabama.gov. And you can simply search for proclamations. And then there's a little form you can fill out. And I'm sure all states have this because I think that they use a similar template. But I began doing that early on, around, I think it was right after Helen Osborne came out with the opportunity and the idea to promote October as Health Literacy Month. So I got busy. I was not the most influential, but I knew people that were. So I began connecting with them and sharing with them my story. I had some really profound, people love storytelling. So I had some really profound stories to tell about my patient care related to the differences that it had made. And I encourage you to really be prepared before you go and talk to those influencers, because if they know that you have really studied this and you have the facts down, that it will make a difference. HCAP's data collection has helped tremendously. But establish your core group of advocates months ahead of of October. I would start now working on next October. Host a Zoom call to gather support from all of those people and influencers who can utilize the strategies that will help to support your goal. Make sure that it is interprofessional, interdisciplinary, and that you have persons of influence. Every single one of you have elected officials that can be contacted at any time. They may not know you, but you can get to know them. And if they know you are voting in their district, they tend to listen to you. Then you kind of start networking out with those that are not in your district, who on your core group of, support, who do they have that they can call? So it kind of grows as a mushroom would from one place to the other. And then make sure you include your C-suite executives. Engage Blue Cross Blue Shield. If you have United Health in your state, they are a big advocate and they have done a lot of health literacy initiatives. And so I definitely encourage you to get some executive from that organization involved in some way, because they can move mountains for you. And last but not least, as I said, to contact your state senators and your representatives to say, let's, you know, and you may want to wait and get them involved after you get a core group established so that they know it's not just you coming to talk to them. Next slide. So proclamations, this is what it looks like when you go online to most of these states, and it just talks about, you know, how they want to honor you, this and the other. The ideal scenario is for you to get in front of the governor just for a 2-minute, let me tell you real quick what is going on here. Reach out to the policy advisor for the governor. Reach out to the health committee for the state Senate and your health committee for your House or your legislators in the state in which you live. I know others have assemblies, but they all have committees. They all have health committees. That's a great place to start, to say, can our group carry you to dinner one night or lunch one night, and let us share with you our vision for how we want to create an initiative in our state. And when I first began working with trying to get a state center established, there were maybe 12 states listed on the CDC website. I think the last time I looked, it's about 25 or 26. And so we're growing. And the goal, I'm sure, and this will help it for those of you who don't have one in your state, is to, you know, you have to start somewhere. And so begin with that grassroots effort. And if you're not familiar with how to do that, again, that micro-credentialing module is an outstanding way to do that. But it's very simple. You just click on it, you fill it out. During COVID, they would mail me the certificate, which is not what I wanted to do. And so I thought, okay, well, I'm going to contact my state senator and legislator and House of Representatives and get her to meet me. So we gathered a group that were interested in health literacy. We had a photo made, and we did just a brief press release that went out through the University of South Carolina College of Nursing, and then it hit the university, and then it expanded from there. And so this is not rocket science, you know, but it's something that you be creative. Think about how you can show others, and those stories are so very important, but you have to keep it to an elevator speech, 30 seconds or less. And one really big tip I would give you is, in reaching out to your elected officials, find out if any one of them have been impacted by a family member who has had an experience where they either had a disease process that was hard to understand, and or have been through challenging experiences related to whatever related to healthcare. Because what do we know? Everybody needs an advocate for them. And unfortunately, those that are not in healthcare, we're the 12% that are proficient. The others, no matter how highly educated they are, they may not understand the lingo. My husband was diagnosed with polycythemia vera, and I was like, what in the world is that? Well, I was a nurse with a doctorate, but I had to study it for months and months. And if I did not know some of the words and how to, I would have been completely lost. And so my heart goes out to those people who really do not have anyone that can help them in their family. But I think that the next slide is just a photo of some of our presentations with the governor. Scarlett, are you with me to change the slide? There we go. And so I'll end it with that, and we're going to move on to the next speaker, but I will look forward to hearing any questions that you might have. And our next speaker is Laura DeRuiter and Williams and Elizabeth Squires, and I welcome them to follow me and share with you their experiences. Thank you all so much.
Thank you, Joy. Can you all hear me? I think.
Yes.
Sure, I'm on. Okay, thank you very much. So I am Lori DeRuiter Willems from Eastern Illinois University. I apologize, we have pollen and things that are affecting my voice today. Beth Squires is my colleague from the University of Illinois system. She is actually with the Illinois Public Health Association annual business meeting right now, having our resolution voted upon and approved. So Joy, thank you for sharing what you did. I have completed 3 of the 7 micro-credentialings with the IHA, and I appreciate every one of them in my own work, in interacting with friends, family, and community members, but it also very much drives the teaching that I do for undergraduates and graduates in public health related to health literacy. So I do believe that that's very important. And I had a similar experience with Joy. In my early phases of studying health literacy for myself, my father had an aneurysm rupture with basically a stroke. And my learning curve went really fast, health literacy on that. He survived it, fortunately. My dissertation later was related to osteoporosis and knowledge of college students' impact with osteoporosis. It really comes down to health literacy. So just a little bit of background of how I ended up here. So this past summer, we got a call or an email with a call to write and submit health literacy proclamations that would be shared during October, the Health Literacy Month. So Beth and I are chairs of the student section of the Illinois Public Health Association. This is our state organization that's part of the American Public Health Association. And from what I'm understanding, IPHA is one of the larger and more active state organizations with APHA. So we have several, I'm thinking close to 100 students participate in our student section. So when we got the call to write a proclamation, basically, which is just a declaration of why there's an issue that is important, and it is shared through certain levels, and as Joy shared, ultimately it would be approved by your state organization. So that's what we're in the process of doing here in Illinois. So we decided for the student section that we were going to write just a general proclamation related to health literacy in Illinois. So the process is here, how we went about this. We put a call out to our students. This happened in the summer. So we had Dora from University of Illinois at Chicago responded. She's a master's student there, and she also has experience with policy writing. So it was a very easy process for us to include her in the writing of this. So we met through Zoom a couple of times. We kind of shared ideas, what we thought would be important to include in our resolution. And we sent her several examples of previous policy resolutions that have been adopted by the Illinois Public Health Association. Those, I believe, are available to anyone at ipha.org. That's Illinois Public Health Association. So what we shared with previous resolutions, some documents that Beth and I both use in our teaching on how to write a policy resolution. And then we really dug into some of the health literacy data specifically for Illinois. And that's what drove the writing of our resolution. Like I said, we had our Zoom meetings originally to develop the scope and the ideas of what we wanted to include. Dora wrote a draft, and we had minor revisions to make. She just did a great job of sharing those with us. I just realized my screen wasn't quite full there. So, but we had a few revisions to make. I'm going to try to jump over to the web page. I think I can do that. Bear with me one moment because it'll be much easier to see if I can find it. Here it is. Yes, so here is our webpage. This is our resolution for Illinois that was, as I said, created by the student section. It has several whereas statements, and if you would like to read this, it'd be probably easier for you to read directly from the webpage. But the whereas statements are basically the supporting evidence of why we think it's important. So we have statistics for adults living in the United States who have low literacy level. As you see, the very first one, it says 88% are living with a level that is inadequate. That completely complements what Joy said, that 12% are considered health literate. So we match there, which I'm happy to read and know. It goes through the statements, a variety of things of supporting why this is important, the costs that are associated with the individuals seeking healthcare, seeking resolution and for healthcare issues if they are of lower health literacy. Some other issues that were developed over the last couple of years during our pandemic. And then finally, the therefore phrase at the very end is that Illinois Public Health Association is seen as a public health leader in Illinois. And this is what we want to support. And we want the IPHA to endorse this and support the development and dissemination of materials so that individuals will have better access, have accurate, accessible, and information that they're able to read, understand, and use, which is, if we go back to the very basic definition of what health literacy is, it's to be able to find it and to ultimately use it and understand it. So these are the therefore resolution statements at the end, and a whole series of references after that. There was another one that I think I can share that I think I'll save that for later. Let me go back to my slides. Bear with me a moment. Okay, so there is the process. Very small version of what our resolution was, followed by all of the references. Those were ones Dora identified, as well as ones that Beth and I provided. And then finally, I thought this was, I'm not able to make it full screen for some reason. Anyway, right now, as we're speaking, we're at the final phase. The Illinois Public Health Association business meeting, annual business meeting, is happening right now. And within about 30 minutes, all 11 of these resolutions will be resolved and approved by the body of the Illinois Public Health Association. The assembly year, I think, believes it begins in November, and all of these resolutions will be presented to our governing body here in Illinois starting in November. So there are 11, which apparently is the largest we've ever had for the Illinois Public Health Association. And I'm happy to also share that not only do we have the general one, Health Literacy in Illinois, that was created by our student section, the very resolution 11 was created by another section, health literacy related to COVID and monkeypox vaccines. So this is obviously a very important thing that we've recognized in Illinois through the Illinois Public Health Association. And again, I welcome you to go to IPHA, looks like it's .com, I think I said .org, but you can look at all of these there. And within about 30 minutes, they should all be approved. When I left that meeting before coming here, they were on to number 3 already. So that's where I am, what I have to share from Illinois. I truly believe that health literacy is vitally important for everyone. And I think Joy mentioned a little bit, but I also heard this in my previous meeting, that along with understanding health literacy, a really important component is to understand our social determinants of health, which lead right into health literacy. So with that, I'm going to stop sharing my screen. I believe I've stopped, and pass it on to, I think, Teresa and Karen are the next group speaking. So thank you very much.
Thank you, Laura. While we're waiting on Karen and Teresa to get set up, be sure and put your questions in the chat box. We will come back to those and address those as we wind up with the next presentation, and want to make sure everyone leaves knowing everything they need to know about getting their state listed on the state website or the CDC website, and at least begin an initiative that has a proclamation that kicks that off. So Karen and Teresa, it is yours to take over.
So thank you. I was having a little technical difficulty getting my slides to share, but I think we've got it now. So I will be presenting about Texas's health literacy proclamation as far as what we've done and how we got there. And so I entitled it, "Is Anyone Listening?" Because for a long time, I felt like no one was listening, and all I was doing was, pointing out the fact that we didn't have any organized effort towards health literacy in Texas, and that this legislation was sorely needed, or there was some legislation that was sorely needed in Texas in order to move things forward. And I discovered that during my doctoral residency program, because of course I was focusing in health literacy, and must have been the first one in the state of Texas to really be able to put that much time and effort into it. So on my journey to achieving the governor's proclamation in Texas of Health Literacy Month, the first step I really took was to review existing policy around the country, because I thought, well, if I know what everyone else is doing, it would make it that much easier to make the case in Texas. And I wanted to, perhaps learn from best practices across the country as well. So that was my first step. The second was to review supporting literature. And all of us, if we come from academia, all of us in academia know that that's one of the first things that you do as well, is you kind of find out what's existing, you review the literature, you find out, from your constituents what's going on, and then you kind of triangulate all of those things before you write your document or whatever it is that you're working on. At the same time, I was gathering support. So during my doctoral residency, I was meeting other people who were also interested in health literacy and really developing relationships across the state. So then we took all of those things together and wrote the proclamation, submitted it, and then a few months later, I was at work and my boss came in and said, "You have a letter from the governor." And it, sure enough, was our proclamation. So that was super exciting. So when I reviewed the legislation existing at the time, there may be more now, but the states that actually had existing legislation were Maryland, Massachusetts, Minnesota, New York, and Louisiana. And what they kind of, as a conglomerate, hoped to do, either sought or were doing, was intervening in provider education, healthcare community outreach, making sure that students in healthcare education were getting educated about health literacy. And I think one of the most important aspects was embedding health literacy concepts into K through 12 education. Because if we're going to move the needle on health literacy, we need to start grassroots with those, a new generation coming up, and then have people become health literate throughout life. What I found in Texas is that the current efforts were not aligned, and that we lacked sufficient support and funding. And of course, you always want to put it in, when you're talking to the legislator, in the aspect of your constituency's overall health and wellness. So that's what I pointed out, is that, to have healthy Texans, we need to look at health literacy. So then I pulled statistics about literacy and health literacy in Texas. Again, these were from the time that I did this. This is an unpublished report or study that was done specifically in Central Texas, but it did show that there was a large need for health literacy legislation and work in Texas. And then similarly to the presentation that you saw before, I also am have a degree in public health and certified in public health. So of course I turned to the Texas Public Health Association. They asked me to write their resolution similarly to what you just heard. And so I took all of those facts together and wrote the resolution for Texas Public Health Association, which passed, and included all of the aspects that I talked to you about before. And if anyone's interested in seeing that, we can share it after the presentation. And it's what I shared when Karen speaks right after me. You'll see that some of what we wrote in our packet that we developed came from what I had written in the Texas Public Health Association. So I also worked closely with the Texas State Health Coordinating Council. So it's, you know, bringing together all of these constituencies that are working towards health in your state. So their vision is that we envision a Texas in which all are able to achieve the maximum health potential. And so I'm not going to go through each of their things, but, you know, it's basically health equity and health literacy. So it was, of course, a no-brainer to partner with them. So then, you know, getting active, and the speakers have been talking about, you know, rallying in your state around all of the different efforts that are being made, but being active, especially in the legislative sessions. We've had 3 different health literacy bills. None of them have passed for political and other reasons, which I think, you know, it's a challenge. It shouldn't be. It should be what we know should be done, but for some reason, there's political pushback against health literacy, at least in Texas. And so, but the good thing is, because of my work with the Texas State Health Coordinating Council, many of the things that I had suggested were adopted in our state health plan, even though there was no legislation. So what can you do? Make your opinion known. Like, long after I finished my residency and I was back in Fort Worth working, I had to move to Austin, the perfect place to get involved in legislation in Texas. I got a phone call. Are you going to come testify on the health literacy legislation? And I was like, I thought you guys were sick of me. So I was like, of course. But present your ideas and talk about health literacy at public meetings, write letters to the editor, newspaper, magazine, everything you can. Local, state, federal legislators, make phone calls, send emails, conduct a public forum. If you want to be directly involved, run for political office, collect petition signatures to send to the legislator, write op-eds, and you can see, you know, pretty plainly here, it's time for health literacy law in Texas. Join or start an interest group. I happen to be a registered dietitian as well, and we have a political action committee on in the registered dietitian organization. So I was able to work with them as well and learn from them about how to strategize about policy and legislation in Texas, but just any and all groups that are working towards your same goals. Testifying, many people can't lobby as a part of their job, but if you can testify or you know, be on the bill, then that's great. Peaceful protests, such as the day at the Capitol, our nurses do that, dietitians do that. Why not health literacy experts? And health literacy month celebrations, of course, and then don't give up. I've learned that lesson, if nothing else. So thank you, but you know, just knowing that all of these facets can help you to get where you're going, whether it's legislation or proclamation. And now I'm going to turn it over to Karen Commodore to talk to you more about the group that we put together, or she put together, and we all worked on a toolkit. Karen, you're muted.
Thank you. I really appreciate the opportunity to be here today. So I'm coming to you today from Cleveland, Ohio. I am, like was noted, director of the Health Literacy Institute here at St. Vincent Charity Medical Center, where I've been doing my work in health literacy since 2007. And it was around 2013 that I co-founded and served as president of Ohio Health Literacy Partners. So right now I'm immediate past president. We have a board of directors, 10-member, and I'm trying to share my screen where I can pull up our website, and it looks like it's not, oh, here it is. I'll go ahead and share. So this is Ohio Health Literacy Partners. Again, it was founded in 2013, and we received our determination letter for 501c3 in 2018. So our team and our membership, our board of directors meets every month, and we have membership meetings that are held quarterly. And a good part of our work included developing resources and collecting resources that would be of assistance to patients and consumers, providers, as well as organizations. So it was just this year that we started our conversation about needing to get more into policy, getting our Ohio governors group and state senators involved. So this was all very timely. It was just several, I believe it was like several months ago, we were at a meeting of the Health Literacy Regional Network. And that's a group of health literacy experts from around, we average about 12 different states that meet bi-monthly, where we just share different resources and experiences. And one of the conversations several months ago was wanting to come up with some type of template that we could offer other states in order to go after a proclamation in their own state. So the Proclamation toolkit was developed, and I'm going to share here the Health Literacy Proclamation toolkit from the Health Literacy Regional Network. And the authors are Amy Chesser, Janelle Lamont was the lead of our group, myself, and of course our Teresa Wagner here. So what I'm going to do is just take a few minutes, because I really want to have time for questions and answers to go through this. This is located on the IHA Solution Center site. So I'm not going to read this to you. I want to just give you an overview of what's included in this toolkit. So the table of contents kind of gives you a snapshot of what's included. So we initially knew we wanted to give a background. First of all, what is health literacy? So really wanting to show that the recent definition did come from Healthy People 2030 goals. And then we gave a background, of course, of the American Medical Association in 2007, estimating that 9 in 10 Americans lack sufficient health literacy. So, so basically, this is just all of the background about what the problem is. In our introduction, we wanted to ensure that we included and recognized Helen Osborne, who first proposed Health Literacy Month in 1999 to raise awareness. And I know because of her efforts, there are organizations all across the country that are celebrating with different events every year, Health Literacy Month. Also, we wanted to identify who the primary audience for our toolkit would be. So we've gotten it on the IHA website, but we want to be able to target different state health literacy coalitions, universities and colleges, health departments, different healthcare organizations, advocacy groups. So we want to promote this toolkit so that these groups then may be able to start the initiation of this proclamation. So we talked about, first of all, what the proclamation is, the fact that it's usually signed by a governor, a county chairman, or a city mayor. I can tell you in 2011, I also chair our City of Cleveland Health Literacy Initiative, and we had a resolution signed by our mayor in 2011. Most requests is already shared, usually have to be submitted 20 to 30 business days prior to getting your proclamation. What's also included in this toolkit is access to all the states where you can click on to the page that will give you directions on how to submit a proclamation. Now, some are different than others. And I saw that, you know, with Alabama, with others, Texas, it seemed to be a little easier than it is in Ohio. And I was going to try to click on it, but I wasn't able to. But when you click on Ohio, it said if you want to submit a proclamation, email, and then you get to another section where you can just write a blurb. So there's nowhere that you can send an actual email. It's only a comment box. And unfortunately, we've submitted a couple of times, have not yet gotten a response. So we are still working on it, and we are not giving up. So planning and promotion is another section that we are highlighting here, and also recognizing the Health Literacy Month handbook created and written by Helen Osborne. So we give a little bit more information there about what's all included in that handbook and different activities that you can do in Health Literacy Month in October. So the following are tips for planning and promoting an event around your proclamation. So first of all, developing a vision for the event, determine who your key audience will be. It can be as big or as small as you decide is appropriate or something that you desire. So government officials, healthcare leaders, leaders from the education realm, nonprofit and advocacy leaders, funding agencies and foundations is already noted, and media and the press. If you want to really increase your awareness, getting the media and the press certainly will be beneficial. We recommend developing an invite list for your event, sending out a save the date flyer ahead of time, creating an event registration, and then determining what the structure of your event will be. Virtual, will it be hybrid? Consider partners and collaborators and sponsors. And what's really important is aligning your content with the goals and objectives of the event. So you want to make sure that you have expert speakers. And sometimes it's good to have outside speakers, maybe national experts, but sometimes thinking local and getting one of your local speakers, experts, really pulls in more credibility for your state. Decide whether or not you want to have any type of educational event associated with your event. So I'm not going to go through those different types because that can all be read on the website. I want to get to the attachment here in a moment, but I do want to mention the Health Literacy Awareness Month ribbons, which are available. Those ribbons are shown on the front cover of our toolkit here, and they were created by Dr. Janelle Lamont during the Minnesota Health Literacy Best Practices Conference. So these ribbons are available for purchase through the Ribbon Factory. So that will all be available for you to access, again, on the IHA site.
Karen, thank you so much. We are approaching 10 till.
Okay.
Is there anything else that you want to share in closing?
Yeah, just in closing, I want to just share that the State Health Literacy Proclamation template is included in the toolkit. And there is a place in here where you can put your state's specific data. So okay. This again is you can access from the site.
Thank you. Thank you so much. I applaud all of my co-presenters today. It's amazing. I sent an email yesterday asking, did we want to get together to make sure we weren't redundant? And I just knew we were all going to be saying the same thing. And I don't think any of us gave you any redundant information. So it goes to show you how diverse health literacy and the opportunities are for you as an individual to get involved. And I really, really want to hone in and make sure everyone knows any group that is part of a health literacy initiative moving forward, make sure it's not just a group of nurses, make sure it's not just a group of social workers or a group of whoever. It has to be interdisciplinary and interprofessional for people and multi-sector, and bring consumers on the board. Oh my gosh, consumers can be your greatest asset because they can truly tell their story. Health literacy councils that are, literacy councils that are already established in your state. That is one of the things that's on the strategic plan for Alabama, is to coordinate who all those councils are, because most states have one, but nobody knows them. Doctors don't know who to refer people to. But I wanted to get to the questions that were in the Q&A box, and I'm going to ask my colleagues that presented today to be looking at these, and I'm going to call on each one of you to answer one. Dory says, I've been doing some research and it seems like the latest health literacy data is from 2003. Do you know if there's more recent health literacy data? If not, do you know if there are plans? I will take that while my colleagues look at the other questions, but I will tell you, Dory, when I first began doing this, 2003 was pretty current because it had first been done in 1993 under the Clinton administration, and it was the NAL, N-A-L. Now it was the NAAL, which was National Assessment of Adult Literacy, and it did include a health literacy component, which the first one did not. There has not been another funded national United States survey done. I am not aware of one that is being planned to be done. However, there was a world international survey done, and it did not bear out that America was doing very well. And there's a lot of information that you can find in that. I won't go into a lot of detail, but if you go to the health literacy, if you just Google health literacy data map, it will connect you to the North Carolina Chapel Hill website. And I believe Darren DeWalt began that work, but it will tell you what your rankings are, and you can get it down to the county level. And that's the most up-to-date information I have, but I think it still goes back to a lot of the data that was done in those early years. And so we wish the government would do that. That would be a great policy for our Congress to take on. Unfortunately, right now, that doesn't seem to be in their purview. I will share one more thing with you as far as national legislation. Back in the late 90s, early 2000s, Coleman and Harkin, they actually submitted a bill that began to get some traction, but it did not. And it was for a health literacy center to be established in every single state in the United States. You can still find that online. And I can't remember which Congress it was, but if you'll just put Coleman and Harkin health literacy bill, you probably will get it. If you can't, you can email me. But it floundered. But the good thing about it floundering is that I'm not sure this should be in public health departments. As good as wonderful of work as they do, they're overwhelmed, and sometimes it gets swallowed up. I almost believe it needs to be a nonprofit outside of a health department. Now, I've talked enough, and I want to give others a chance. Who would like to take the next question about universal health care for all Americans?
Well, I'm sorry, I was going to answer a different question, and also
go ahead.
Comment about just to build on what you had just said about not being in local health departments. So yeah, in Texas, we actually ended up establishing Health Literacy Texas as an independent 501c3 nonprofit in order to not only champion health literacy on its own. So, you know, taking that burden off of the Public Health Association, but also because we wanted it to be bipartisan, to where all of the universities and all of the healthcare entities within Texas would be willing to join that and work together to champion health literacy across Texas. Whereas if it was housed in my institution, people at other institutions might not be willing to join. So that's one thing we've done in Texas. And then so that builds on the question I was going to answer, is that they had asked about our organization. So yes, there's a website for Health Literacy Texas where you can find more information about what we've done, but also if you go to the Contact Us page and fill that out, you can join if you live in Texas, or have someone reach out to you to tell you more.
Jolene, you asked about restating the website again. Which website are you speaking of? Is it the data map?
Healthliteracytexas.org.
Oh, okay. And Jolene asked a question about, Jolene, you email me privately and I will answer that. Tiffany asked, do most or all hospitals have their own health literacy proclamation? Would Karen, would you answer that? I think you would be an expert to answer that because of your work.
Sure. No, I don't believe hospitals seek out their proclamations. Proclamations are typically given through local, citywide, countywide, statewide, and for organizations and hospitals, if they are interested in health literacy and have been doing work in health literacy, many are working on becoming a health literate healthcare organization. But proclamations, again, are more at the city, state, county level. And I can tell you that our group working on the proclamations also developed a template for a national proclamation that we're just about ready to send. So I wanted to mention that as well.
Someone asked early on, why is it important for us to have a proclamation, or does it even matter? Who would like to answer that? Lori, we haven't heard from you.
Sure. I think proclamations are a nice, succinct way to explain why a particular issue is important. And I can only speak for Illinois. I did live in Texas for a couple of years, but as a student, buried in books. So, but here in Illinois, I know that, we do have a strong Illinois Public Health Association that lobbies strongly with our state government. Within our association, it's very well represented by public health departments, some medical institutions, plenty of university and college representation as well. So that's kind of here, at least here in Illinois, how we feel like it's the information is shared, health related information. And I think the writing a policy resolution or a proclamation, following a template like Karen has available, or general Google search, they're not difficult if you do a little background on it. So I do think they're not difficult to write, but I do think they have some nice impacts because they can be seen by a wide number of people. As we've been sitting here today, I thought I've been remiss because our Eastern Illinois University is a small town. I have a light, apologize there. So our small town mayor and our university president work very closely together. So I think it would be easy for us here on campus to write a new policy resolution proclamation for Health Literacy Month to share in Charleston, Illinois.
That'd be great. We have 2 minutes left. And one thing I would like to ask that IHA provides for everyone is my email address. And if I think that the other presenters would be welcome to allow you to email them also with questions as we follow up. Nothing would make me happier than for every single state to be listed on the CDC website in having a health literacy initiative. And I would love personally to help any of you any way I can to start that effort. And I know that this group of ladies would feel the same way. And we know many people that would also want to do that. That is really all I have. We have 1 minute left, and I know that Scarlett has kept us on a very tight leash. So I'm going to close by saying thank you all so much for being here today. Thank you so much to our absolutely fabulous presenters, and they were being very modest. There is a lot more that they have done and could give you, but with our limited time, we have just a little bit of nuggets that we've shared with you, but feel free to email us. And I can be reached at the University of South Carolina on my website. And if you look at their organizations and their names from the advertisement, you ought to be able to find them easily too. Thank you all so much and have a wonderful rest of the conference.
Thank you.
Thanks, Will.
Thank you.